Dr. Powell, thank you so much for joining us here on Health Connection. Our topic, strep throat, it's not just for kids. And we associate strep throat with kids. It's something we normally, associate with the raising of children. But it also occurs in adults. Let's get a definition. What is strep throat?
Strep throat is a bacterial infection of the throat region caused by Streptococcus.
What are the symptoms of strep throat and how do we differentiate it from a garden variety sore throat?
Strep throat usually is an acute onset of severe throat pain accompanied with high fever. Sometimes you'll have nausea with it because the strep can go further down into your esophagus and stomach.
You said the Streptococcus bacteria, that's opposed to a viral infection, a bacterial infection, as opposed to a viral infection. Discuss the differences between those two.
A virus we generally don't have medication for, just symptomatic treatment. Only virus that we generally give medicine for is influenza. It has a medicine to stop the replication. Bacterial infections, we have antibiotics that help stop the bacterial replication and help your own body heal its infection.
Okay. How do we test for strep throat? How do we know that it is strep throat?
We have a rapid strep kit that we can swab in the office and run, and it tells us if it's strep or not. Although it's a screen, about 20% of the time it does miss the strep throat, so we will send all negative tests off for a culture.
Okay. What can happen if we let strep throat go untreated?
Strep throat has the potential to form toxins that cause your body to attack its own tissues, causing things like scarlet fever, rheumatic fever, toxic shock, and those type of complications.
You mentioned antibiotics. How does an antibiotic work to overcome strep?
The antibiotic stops the bacteria from reproducing, so then your own body's defense mechanisms can come in and absorb the bacteria and cure the infection.
Okay. Strep throat, is it contagious? And are adults more or less likely to be susceptible to it?
Strep throat is highly contagious, especially in close quarters, or eating or drinking after somebody, kissing. Adults are probably a little less susceptible because we've been exposed to things before, maybe have better resilience, and we tend to have a little bit wider social distance, and we don't tend to share food and water bottles.
If you're treating a child at home who has strep throat, are you susceptible to contracting it yourself, and how do you avoid that?
I would say try to keep the person that does have the strep a little bit more isolated and teach them strict hand washing and covering their mouth when they cough, and especially not to share food or drink or toothbrushes. You want to make sure they're not stored with other toothbrushes, and after the illness is over, you probably want to give the person a new toothbrush.
How common is it in your practice with respect to adults and strep infections that the typhoid Mary is one of their kids?
Actually, today.
Okay.
Yeah. And actually, I treated the son and the mom came in today, so pretty common. Well, mom did admit sleeping with them to comfort him, and so she probably was not keeping a decent distance. But it's hard when they're hurting. You want to be there for them.
Right. Do you treat strep differently in adults than you do in children?
It's the same antibiotic, same course of treatment.
Are you more likely to get strep throat if you still have your tonsils?
Not necessarily. The tonsils are your first line of defense against infection, but there are some people that get recurrent strep. There's the theory that if you take the tonsils out, you'll get less infection because the tissues aren't there to get infected or harbor any strep.
We need a prescription for an antibiotic. That means going to see a doctor or a health professional. But short of that, can we treat strep at home?
You can use symptomatic medicine, saltwater gargles, Tylenol, Motrin. There's lozenges and chloroseptic spray you could try to help feel better.
What is the likelihood of overcoming the infection doing that?
With that antibiotic, in theory, you should be able to heal yourself. You just don't want to have the potential toxins form and then have the complications.
Okay. Can strep throat ride the coattails of other illnesses? So let's say you have bronchitis or the flu. In other words, if you're already sick, are you potentially more likely to contract a strep infection?
In theory, if your body's defenses are down fighting other infections, you can get a secondary infection.
Okay, so that means
I see strep and flu together quite a bit.
Okay. What can we do, if anything, to avoid getting strep throat altogether?
Well, if you're coughing, you need to cover your mouth, like cough into your shirt or cough into your sleeve. Don't drink or eat after anybody, and try to keep, a little bit of a social distance between other people so you're not catching things that are aerated.
This is a question that we ask all the time with respect to these kinds of illnesses. How do you know when or whether to go to the doctor and seek treatment?
Most of the time, I think, depending on how acute of an onset it was, or if there's fever or pus pockets in the back of your throat, would kind of indicate you need to go to the doctor. If you wake up with a little irritated throat and it's gone within an hour or so of getting up and moving around, it's probably just drainage, either from reflux or allergy drainage back on your throat.
Okay. Is it fair to say that if the pain is much more intense than...
Or if it's pretty persistent, or you can't get to go away with just drinking a little warm water or something, and you have any of the other symptoms, you probably want to get tested.
All right. Doctor, we thank you very much. It's been very informative.
Thank you.